Hello and welcome to this lecture. Today we are going to discuss tubulointerstitial nephritis, and I'm presenting another case of a 26-year-old man developed pneumonia, hepatitis and biopsy, verified acute tubulointerstitial nephritis, coinciding with the rise and fall of complement fixing antibodies to mycoplasma pneumonia and mycoplasma pneumonia antigen material and complement C3 in the renal interstitium were shown by immunohistochemical techniques. So the location of the disease is usually in the interstitium and tubules, and the causative factors which will be the bacterial infections. Sometimes drugs and toxin are also involved for tubulointerstitial nephritis that can damage the kidney. For example, acetaminophen or some psychostimulant drugs are also responsible for tubulointerstitial nephritis. They are classified into acute and chronic. When we talk about acute pyelonephritis, it is an inflammation of the kidney and the renal pelvis caused by the bacterial infection, usually occur in the lower or upper urinary tract. When we talk about the pathogenesis, the microorganisms such as enteric gram-negative rod, they travel, and I mentioned that the hematogenous infection such as E. coli or staphylococcus, they enter through aorta and then they reach into the kidney, where it can affect in the form of pyelonephritis. And you can see this foci, certain sections and segments are affected, and I already mentioned it usually affect upper part or the lower part. And if it affect the upper part, you can see that this is upper part section, and the lower section, it can be explained above pyelonephritis. And then you can see that if it reach from the lower side from your urethra, from your urine, then it can travel reverse back to the kidney through vesicocortical reflux and can cause the infection. So vesicocortical reflux, so the movement of infections such as E. coli or enterobacter that travel from the urethra to go back can affect the kidney. UTI is the most common example that can lead to tubulointerstitial nephritis. Usually the size of the kidney will be enlarged. There will be yellow raised abscess and the presence of on the renal surface, and there will be papillary necrosis will be found. And if you cross section the kidney, you found the papillary necrosis in the interstitial spaces. The clinical cause consists of the urinary obstruction because either congenital or acquired because of the bacteria. And to remove the blockage, we need to do instrumentation of the urinary tract using catheterization. And through vesicocortical reflux, it can affect to the kidney as well and other parts. Pregnancy is also one of the reasons that can result to this disease. Around 4 to 6% of the pregnant women develop bacteriuria sometime during pregnancy, and 20 to 40% eventually develop symptomatic urinary infection if not treated. The onset of uncomplicated acute pyelonephritis is usually sudden with a pain and a systemic evidence of infection such as chill, fever, nausea, malaise, and localized urinary tract, sign of dysuria and frequency and urgency will be found. There will be the formation of pus as well. This disease could be caused because of the diabetic mellitus or immunosuppression or immunodeficiency. It is also responsible for the development of prostatic hyperplasia, especially in males, because of the outflow obstructions. So the obstruction is very important. If it is obstruction caused because of the pus formation or because of the bacteria then it can lead to prostatic hyperplasia. So thank you so much for today's lecture. Hope to see you again.